Hey everyone, and welcome. Today, we're going to dive into a really potent heart medication called Flecainide. Now, for some people, it's an absolute game changer for controlling dangerous heart rhythms, but it's definitely not for everyone. You can think of it as a super strict traffic controller for your heart's electrical system.
So let's start with a question. What actually happens when your heart's electrical system just goes haywire? Well, that's kind of like a sudden electrical storm kicks off inside your chest, throwing your heart's rhythm completely off balance. And that's exactly where a drug like Flecainide steps in.
So here's our game plan. We'll start by talking about that electrical storm. Then we'll meet our traffic controller, Flecainide, and figure out what it does. We'll look at who it's for and, just as important, who needs to stay away from it because of its serious black box warning. And finally, we'll cover the essential rules for using it safely.
Okay, first things first. Before we can understand the solution, we have to get a handle on the problem itself, this electrical storm in the heart that doctors call an arrhythmia.
You know, an arrhythmia isn't really a problem with the heart muscle, it's a problem with the wiring. The electrical signals that are supposed to tell your heart when to beat just become completely chaotic, disorganized, and way too fast. It's an electrical riot, and it creates a really unstable rhythm.
So, you've got this electrical storm raging in your chest. How on earth do you calm it down? Well, this is where our traffic controller, Flecainide, enters the picture.
Now, Flecainide belongs to a group called Class IC antiarrhythmics. What does that mean? Well, basically it means it's one of the heavy hitters. It's incredibly potent because it directly targets that faulty electrical wiring in the heart, and that makes it super effective, but it also means you've got to treat it with a whole lot of respect.
Okay, so let's break down how it actually works. Every single heartbeat kicks off with a tiny spark caused by sodium rushing into the heart cells. Flecainide's job is to step in and block the channels that let that sodium through. It's like a traffic controller at a chaotic intersection, forcing all the cars, or in this case, the electrical signals, to slow way down. This is amazing at stopping those rapid-fire chaotic rhythms and bringing some order back.
So, given how powerful this drug is, you have to ask, who is it actually for? This is definitely not a one-size-fits-all solution. In fact, picking the right patient is absolutely critical.
Its sweet spot is for what are called paroxysmal arrhythmias, the sneaky ones that tend to come and go. It's really well known for treating things like atrial fibrillation or AFib. In those cases, it's used to help keep the heart in a normal rhythm and, hopefully, prevent those episodes from happening in the first place.
And this brings us to what is maybe the single most important rule of all when it comes to this drug. Flecainide is meant for patients whose hearts are structurally normal. That means no underlying damage, no history of a heart attack, no blockages, no weak muscle. The heart itself has to be healthy. And believe me, there's a very serious reason for this.
All right, we need to shift gears and talk about something really serious. Let's look at the drug's biggest safety alert, which tells us exactly who should never, ever take it.
You know, when the FDA puts a black box warning on a drug, it's their loudest, most serious alarm bell. It's a direct message to doctors and patients that this medication carries some major risks that you need to be aware of. And Flecainide has one.
The reason for this warning is chilling, honestly. Landmark studies showed that in patients who already had structural heart problems, like after a heart attack, Flecainide didn't help. In fact, it could actually increase the risk of life-threatening rhythms and death. That's why the line is so clear. If the heart structure isn't normal, this drug is off the table.
Okay, so now that we understand the huge risks involved, let's talk about the rules for using it safely. Because for the right person, Flecainide can be an incredible tool, but it absolutely demands careful management.
Look, any powerful medication is going to have potential side effects, and Flecainide is no exception. Some of the most common things people report are dizziness or feeling lightheaded, and some weird visual stuff like blurred vision or seeing spots. Nausea, fatigue, and shortness of breath can also pop up.
But the one side effect that really makes doctors cautious is something called proarrhythmia. And it's a scary irony. The very drug that's supposed to fix abnormal rhythms can sometimes cause brand new, even more dangerous ones. This is a huge reason why starting this medication has to be done under very close medical supervision. And that supervision is completely non-negotiable. Taking Flecainide means you and your doctor are a team. It involves regular ECGs to watch those electrical signals, blood tests to make sure the drug level isn't getting toxic, and checks on your kidney function to be sure your body is clearing it properly. It's a serious commitment.
Another really big deal is how Flecainide plays, or rather, doesn't play, with other common medications. For example, mixing it with things like beta blockers can slow the heart down way too much. Other drugs can actually cause Flecainide levels in your blood to spike to dangerous heights. This is why it is absolutely vital that your doctor knows every single thing you were taking: prescriptions, over-the-counter stuff, supplements, everything.
So, at the end of the day, Flecainide is the perfect example of a double-edged sword. For the absolute right patient, it can be a life changer, giving them their quality of life back. But for the wrong patient, it's a real danger. And that really makes you wonder, doesn't it? Is this kind of razor-sharp precision, where a drug is perfect for one person and forbidden for another, the future of how we manage heart rhythms? It's definitely something to think about.